Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Tracheostomy. Pediatrics. Introduction. A tracheostomy is a surgically created hole through the front of your neck and into your windpipe. The windpipe is also known as the trachea. The surgical procedure to create a tracheostomy is known as a tracheotomy. Many conditions can lead your child's doctor to recommend tracheostomy. Your child's doctor will discuss the procedure with you and will need your consent to do the surgery. The procedure is safe. Complications are rare but possible.
This program will help you understand the tracheostomy operation and possible risks and complications. Your child's healthcare team will teach you how to care for your child's tracheostomy if he or she will be going home with it.
The trachea. The air we breathe goes through our mouth or nose. It is filtered, warmed, and humidified or moistened before it gets to the lungs. The top of the trachea is protected by the vocal cords. When we breathe, the vocal cords open to let air through. When we eat, the vocal cords close to prevent food from getting into the trachea and the lungs. A tracheotomy is a procedure that places a breathing tube, known as a trach, through an opening in your neck directly into your windpipe. The windpipe is also known as the trachea. The opening created by the tracheotomy is called a stoma. The breathing tube is also known as a tracheostomy or trach tube. It makes it easier for air to get to your lungs. It also helps to remove mucus and other fluids from your lungs. When you breathe through the trach tube, the air enters directly into the windpipe. The usual filtering, warming, and humidifying do not happen with a trach. Therefore, a special machine will be used to provide mist to moisten the air your child breathes. When is a tracheostomy needed? Many medical conditions make a tracheostomy necessary. Some trachs are permanent and some may be temporary. Children who have swallowing problems may need a tracheostomy to protect the lungs from aspiration. Aspiration is the accidental passage of food or saliva from the mouth into the lungs.
A trach may also be used to keep a child's airway open. The windpipe may be too small to allow enough air to get in and out of the lungs. The windpipe may also be blocked. The trach can help the child breathe in these cases.
Severe lung problems and other health problems that affect breathing may require a ventilator to help a child breathe. A ventilator can be attached to the trach tube. If your child needs a ventilator for a long time, he or she may need a trach. This is because a regular breathing tube that goes from the mouth or the nose to the trachea can damage the nose and mouth. Some lung problems can cause a lot of mucus to build up in a child's lungs. This mucus can also clog a child's airways. A trach allows a caregiver to suction out the mucus and keep the child's airway clear, which makes it easier for the child to breathe. Children may also receive a tracheostomy because of a birth defect or an injured trachea.
In cases of allergic reactions where there is severe swelling of the upper airway, a tracheotomy may be done as a life-saving or emergency procedure. The tracheostomy is usually temporary.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Surgery. A tracheotomy is done in the operating room of a healthcare facility. The procedure is done under general anesthesia. This means that your child will be asleep during the procedure. A thin lighted tube called a bronchoscope will be used to help locate the trachea. This is because children have small windpipes. The bronchoscope is inserted through either the nose or mouth. Once the trachea is located, the doctor performing the procedure will make a small cut, also known as an incision, to create an opening in the neck. The doctor then places a curved tube through the opening into your child's trachea. The tracheostomy tube is held in place with a ribbon that goes around the neck. This ribbon is called a trach tie. In addition to the trach tie, the tracheostomy tube is sometimes sutured or stitched to the neck for about a week. This prevents the tube from falling out of the trachea.
After the trach tube is in place, the flow of air through it is tested. The bronchoscope is then removed. A chest X-ray may be done to make sure the trach tube is in the correct spot.
If the condition that made the tracheostomy necessary improves, your child may no longer need a tracheostomy tube. The tube will be taken out and the opening will be allowed to close. In some cases, another surgical procedure must be done to close the opening. Risks and complications. The operation is safe, but complications are possible. Knowing about them may help you detect and treat them early. If general anesthesia is used, risks include nausea, vomiting, inability to urinate, cut lips, chipped teeth, sore throat, headache. Your child's anesthesiologist will discuss these risks with you. He or she will also ask if your child is allergic to certain medications. Risks and complications specific to a tracheostomy include infection of the site, bleeding, which in some cases may become severe, collapse of the lung. These complications are rare. During the operation, important structures in the neck can be injured, including blood vessels, nerves, the esophagus or feeding tube, but damage during the procedure is rare. If the trach tube accidentally comes out of the trachea shortly after the procedure, the opening tends to close quickly. This will make reinserting the tube difficult. The procedure may need to be repeated. Types of tracheostomy tubes. There are different types of tracheostomy tubes. Your child's doctor will determine which type of trach tube is best for your child to use based on the reason for the trach, the size of your child's airway, the age of your child. Your child's tracheostomy tube may just have one tube. Sometimes a tracheostomy tube includes two tubes, with one inside the other. The inner tube is called the inner cannula and is meant to be changed regularly. Parts of a tracheostomy tube can include the tube itself, which goes inside the trachea. This is called the tracheostomy tube or the cannula. If there are two tubes, the outer tube is called the outer cannula. The inner tube is called the inner cannula. A neck plate with holes for the trach ties. The neck plate rests on the neck and prevents the tube from slipping all the way into the trachea. The openings allow a ribbon or trach tie to hold the tube in place.
The obturator, which guides the tube when it is inserted. The obturator is removed as soon as the tube is in place in your child's neck.
Tracheostomy tubes come in two main varieties, those with a cuff and those without. Cuffed trachs have a balloon that surrounds the main tube and is connected to a smaller balloon on the outside. The smaller outer balloon connects to a syringe, which will inflate the inner balloon. The outer balloon will indicate how inflated the inner balloon is. A cuff prevents anything from getting into the lungs from the space between the tube and the inner wall of the trachea. A cuff helps prevent aspiration. The cuff, however, does not allow air to go around the tube when inflated. Air cannot be pushed through the vocal cords, which makes it hard or not possible to speak. Most children who receive a cuffed trach are on a ventilator to help them breathe. A trach without a cuff does not have a balloon at the end. Babies and small children often receive a trach without a cuff, even if they need a ventilator to help them breathe. This is because young children have very small airways. After the surgery. After the procedure, your child will stay in the healthcare facility while you learn to take care of the trach. You will learn how to suction the tube, which can clear the tube of blockage, clean the tube and the skin around the opening, change the trach tube and ties. It takes about 2 weeks to recover fully from the surgery. It may take a while for your child to get used to the sensation of having a tube in his or her trachea. Your child will have a special mask that goes over the trach and is connected to mist, which helps keep their mucus from becoming dry and blocking their trach. It is best to keep the area around your child's tracheostomy dry. Your child will need to avoid getting anything in the opening of the trach that can cause serious breathing problems, such as food particles, powders, water. Do not let your child swim after the procedure. Some children are not able to eat or drink by mouth with a trach. Your child may need to be fed through a tube if he or she has difficulty swallowing. Some children are not able to talk with a trach tube in, but a speech therapist can help your child learn different ways to communicate. Some children may also use a special tube that has a speaking valve attached to help them speak.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A tracheostomy is a surgically created hole through the front of your neck and into your windpipe. The windpipe is also known as the trachea. The surgical procedure to create a tracheostomy is known as a tracheotomy. Many medical conditions may make a tracheostomy necessary. Some trachs are permanent and some may be temporary. If the condition that made the tracheostomy necessary improves, your child may no longer need a tracheostomy tube. The tube will be taken out and the opening will be allowed to close. In some cases, another surgical procedure must be done to close the opening. The operation is safe, but complications are possible. Knowing about them may help you detect and treat them early. Tracheostomy tubes, or trach tubes, come in different types. Your child's doctor will determine which type of trach tube is best for your child to use based on the reason for the trach, the size of your child's airway, the age of your child. After the procedure, your child will stay in the healthcare facility while you learn to take care of the trach. You will learn how to suction the tube, which can clear the tube of blockage, clean the tube and the skin around the opening, change the trach tube and ties. It takes about 2 weeks to recover fully from the surgery. It may take a while for your child to get used to the sensation of having a tube in his or her trachea.
Thank you for using Explain.